Dear friends, I want to thank you so much for joining me here this evening. I'm tremendously grateful to be here with my dear friend, Rav Dr. Benjy Epstein, Shlita, and our colleagues at Amudim Israel, who do fantastic work. If I say nothing else, just know that you should always reach out to Amudim Israel if you have any questions, especially as you are the primary care physicians on the front lines. With that in mind, let's go ahead and talk about acute stress disorder and how we should be evaluating and thinking about this with our patients. You heard me say front lines, and that's correct. Some of us are on the front lines in a very literal sense, literally going and fighting Hashem's war with our hands and our guns and our nunchucks and whatever else Hashem gave us. For others of us, we are in the clinics, we are in the hospitals, we are in our offices assessing patients who have experienced traumatic events, whether personally or secondary trauma of having people they know and having watched way too much content on the internet and news. With this in mind, when we talk about acute stress disorder, we're speaking about the initial reactions that a person experiences to traumatic events and traumatic news. Specifically, we're talking about intrusive thoughts. The idea that what a person has heard, what a person has seen and experienced keeps on coming into their head and makes it difficult to focus on what they should be focusing on in order to get through their day. We're speaking about dissociation, avoidance, and arousal. Arousal is the fast heartbeat that many of our patients are feeling, the tightness in their chest that they're feeling, the shakiness in their hands, their upset stomach, their nausea, their lack of appetite, or their overeating, all of the physical symptoms associated with acute stress. We're also speaking about the depressed, dysphoric, negative mood that people are experiencing as a result of these stressful experiences. Estimates say that about 1 in 5 people who have experienced such trauma will end up meeting criteria for what the American Psychiatric Association describes as acute stress disorder. Now, what causes this? Certainly there's the traumatic event, but there's also a genetic predisposition. And as we know always, there's the campfire kindling, and then there's the matches on top of it. Some people are more likely to have a more severe reaction to stress. And for those people who are coming to your office, let's talk about what we need to do for them. The main thing is, frankly, psychoeducation. I want everybody to sit with their patients and normalize fear, sadness, and anger. These are normal feelings given the amount of stress that our patients have experienced. We should also encourage them to remember that they will likely end up persevering and being fine without further medical or psychological intervention. The vast majority of people do not go on to develop psychiatric illness as a result of being part of a traumatic experience. That's great news, and we need to let our patients know that. I encourage everybody to do a bit of what's called cognitive restructuring. This is where we offer our patients a different perspective and allow them to think about things that help them to feel safe moving forwards, because most of our patients are out of harm's way in the immediate sense. They have what to be grateful for, and we should help them to find those things that allow them to feel safe, calm, and grateful in spite of everything that's happened. As far as psychopharmacology, this is always a big question by the family docs for the psychiatrists. There is no overwhelming evidence for psychopharmacology interventions in acute stress disorder. I'm saying it slow, not because there's something wrong with me, rather because you need to be careful not to overprescribe in these situations. Yes, we should treat severe sleep disturbance and insomnia. Yes, we should be aware that patients who have a history of depression and anxiety are at a greater risk of developing depression, anxiety, panic, mood disorders, psychotic breaks as a result of this stress. But hopefully they are already in treatment with their psychiatrist and can be referred back to their psychiatrist for ongoing management, or if there's a question of renewing medicines, you can do that job of getting people started on the treatment that has worked for them in the past during times of tremendous distress. We should be careful not to hand out benzodiazepine drugs, Xanax, Clonex, Vaben, and other benzodiazepine drugs which are highly addictive and are easily misused. In certain cases, we can hand out low doses of these medicines for a time-limited perspective, which can be quite helpful in allowing our patients to deal with acute stress and acute insomnia. That being said, a lot of education has to go into that, telling our patients that these are not long-term treatments. Let's talk about preventing the development of PTSD after a traumatic event. I'm going to go through 7 specific coping skills that people who engage with them, people who have these perspectives, are able to keep in mind in order to avoid developing PTSD. Number 1, and most important, family and community support. Baruch Hashem, that's big in our system. We have a lot to offer as a kehillah. Continuous contact and support from the people we know and love is critical. Number 2, talk about it. People who are talking about what they've experienced with those whom they know and love are less likely to develop PTSD. As somebody who's hearing what people are talking about, it's important for us to note when to refer them for counseling. Thank God there are a lot of great resources out there for dealing with acute stress and PTSD. There are great free resources and referral systems out there. And again, our colleagues at Amudim Israel are happy to help you with that. Number 3, positive reframing. People who keep perspective. People who identify as a survivor instead of a victim are significantly less likely to develop debilitating mental illness as a result of their trauma. Number 4, staying optimistic, using positive emotions, laughter, smiling. This works for keeping perspective. Number 5, spirituality, meditation, mindfulness practice, connecting with our deep tradition of having a special one-on-one relationship with HaKadosh Baruch Hu is tremendously helpful for our patients. Number 6, giving back, allowing people who have experienced trauma to connect with other people who have experienced similar tragedies in their lives so that they might strengthen each other. And number 7, staying strong, holding the belief that you can survive through traumatic events. This is something that we have to empower our patients to know. You are going to make it, you will bounce back, and you will come back stronger. The power of positive thinking. Trach good v'zayin good, tachshov tov yiyeh tov, Positive Psychology 101. With that in mind, I want to share a few closing recommendations to all of the family doctors, pediatricians, geriatricians, and primary care providers out there. Sobriety. People who are using alcohol and drugs right now to deal with their symptoms are at great risk of developing addiction. People who are addicts in recovery are at tremendous risk of relapse. We should give our patients strength by this and screen for substance use and refer to a professional when necessary and appropriate. Next, psychopharmacology. Do not be afraid to contact Amudim to put you in touch with a psychiatrist who can provide curbside consults and guidance in these cases. Avoid the rush to provide psychopharmacology intervention unless you believe that there are acute reasons to do otherwise. And should you have specific questions, please don't hesitate to reach out to a colleague who is a psychiatrist. If you do not have a colleague who's a psychiatrist, we should be friends. Exercise. Cardiovascular exercise every morning allows one to keep their circadian rhythm and to improve focus, energy, appetite throughout the day, and to improve sleep at nighttime. This is a must for all people. Kal v'chomer, how much more so individuals who have experienced acute stress and trauma. Mindfulness practice. Dr. Benjy Epstein will be teaching us specific mindfulness interventions shortly, and I'm quite grateful for that. We all have what to learn from his significant, culturally appropriate expertise. My man. Therapy. There are specific therapies that are helpful as interventions in acute trauma. CBT for trauma, EMDR are fantastic. Psychodynamic psychotherapy does not have a role in the acute setting, as do many other interventions. We should be quite careful to utilize professionals who have specific training to deal with these issues. Lastly, social support. We are ish echad k'lev echad. That has always been the strength of the Jewish people. If there is anything that this has taught us, it is that no person has a right to Judaism themselves. No person is too far removed from Judaism to be a part of us all. We are ish echad k'lev echad, and we are there for each other. And I could not be more grateful to be there for you and there with my colleagues again at Amudim Israel, who are doing a fantastic job of supporting Klal Yisrael during these challenging times. Peace and victory.
Shalom uvracha. During this Eis Tzar Yaakov, maintaining emotional stability and mindfulness is not only a personal virtue, but it is also a way to contribute positively to the collective well-being. By remaining calm, we not only increase our ability to overcome difficulties, but we also become a beacon of strength and hope to others, helping them find their way to safety and resilience. And if we sometimes don't feel like practicing, if we sometimes don't feel or need the push, it's useful to remind ourselves that we're not just doing this for ourselves, we're doing this for Klal Yisrael, B'Shem Kol Yisrael. I'm doing this in the service of others. And what I'd like to share here during this current time period of really widespread difficult emotions is how to face what we're experiencing in a mindful and compassionate way. And this is all on the level of aspirational goals. We're all in this together. And what's coming up for me, to just name it, is the grief, the anger, all the emotions that Dr. Freedman mentioned. And there's a rawness, but similarly to what Dr. Freedman mentioned, there's also the positivity that's emerged and the unity that's emerged and the possibility that's emerged. And like Dr. Freedman said, Ki ish echad b'lev echad, we will wake up our hearts in a collective way. During this time when we're in hyperdrive, that hyper-arousal state that Dr. Freedman mentioned, with worry and all the challenges, what ends up happening is fear and the difficult, powerful emotions end up causing a tremendous amount of suffering. And during this Eis Tzara, it could feel contagious. So what is it for us to do on a practical level? Even if you're not familiar with the teachings of Rabbi Nachman of Breslov, we're all familiar with his words of encouragement. Da, she'adam sarich la'avor al gesher tsar ma'od ma'od, ve'aklal ve'ha'ikar shelo lihispachid klal. Rabbi Nachman says, know that a person has to cross a very narrow bridge, and we're all on that very narrow bridge. And Rabbi Nachman adjures us, he reminds us, and he says, the main thing is to not be afraid. It's a beautiful sentiment, the notion that a person shouldn't feel fear at this time is absurd and unrealistic. In times of pain and uncertainty, fear is a natural and human response. So Rabbi Nachman's teachings can't be about suppressing our human emotions. Instead, what Rabbi Nachman is teaching us, he's navigating how we can appropriately respond to these painful emotions. Rabbi Nachman is precise in his wording. While the popular known version of the song is Shelo Yifached Klal, that he should never be afraid, Rabbi Nachman writes Shelo Yitpached Klal. The Hebrew verb is reflexive. It literally means he shouldn't make himself fear at all. A reflexive verb is used when you want to express that you're doing something to yourself. A reflexive verb is used when you want to express that you're doing something to yourself, not that something is being done to you or that it's just happening to you. In this context, it's not about something happening to the person, but about what they are doing to themselves. Rabbi Nachman's choice of words, Shelo Lihispached Klal, underscores the idea that we have a degree of control over our fears by how we relate to these difficult emotions, highlighting the agency we have in our emotional responses. Especially in moments of intense emotion, we could worry about being overwhelmed, losing ourselves, just drowning in it all. So to some extent, our primal survival instincts are fight or flight, to just disconnect from the raw emotional turmoil that we are all experiencing right now. We bury or numb our emotions and get lost in our thoughts. But by retreating from these difficult and sometimes painful feelings, we also distance ourselves from the gift of living with full presence. At times, our reluctance to embrace these difficult emotions could lead to depression, chronic anxiety, irritability, causing tension in our muscles and our posture. Right now, my lower back is throbbing. These unprocessed emotions could materialize as sensations of isolation, inner restlessness, monotony. Frequently, as Dr. Freedman highlighted, they could manifest as addictive behaviors. Regardless of how these emotional states manifest, when we resist them, it could lead to states of unconsciousness. The emotions that we end up avoiding experiencing stealthily influences our beliefs, our choices, and our behaviors, and they become invisible forces that constrain our lives. We and our loved ones are all in this together, but by opening to the emotional experience of these difficult emotions allows us to access our natural state of resourcefulness. We've just begun saying Mashiv Haruach Umorid HaGeshem, and through this acronym of RAIN, of recognizing, of allowing or accepting, and then investigating, and then subsequently nurturing, we can awaken an embodied mindful presence, an all-inclusive heart. And here's a teaching that I learned from my teachers, Jack Kornfield, Tara Brock, and Duncan Trussell. And what we're going to be doing by recognizing and allowing these emotions to be there, and then what we're going to do is deepen our presence, that heartfelt presence, in a way that can reduce fear's power. With practice, we discover that when we are no longer resisting these emotions, we may still feel the fear. The fear is there, but we stay connected to a larger space of compassion and presence. And then just a gentle reminder, this is just one tool of many. There are many others like grounding or anchoring yourself, breathing, mindful walking. Exercise is so key. Social connection. Really trusting your own inner resources. Also, what's become clear from clinical research is that when trauma and strong fear are present, it's not useful to directly be open to them. It's important to first soothe and calm yourself and bring in a sense of safety and love and protection. Also, if at any point during this meditation it feels too intense, I invite you to simply open your eyes and stop the practice if you're feeling overwhelmed. All right, so here we go. And I invite you all out there to do this with me. So sitting in a posture that embodies dignity, whatever that means to you. And taking a few full deep breaths. And you might scan and sense whatever might be going on in your life right now. Any of the more poignant, difficult emotions that come to the forefront. And again, I want to reiterate, this is not the time to be bringing up any sense of traumatic fear or panic, but a difficult emotion. Something that doesn't feel too overwhelming right now. And as you bring to mind whatever you're currently feeling right now, experiencing right now, to make it more immediate, see if you can just visualize in your mind's eye, whatever it is. It could be involving another person. Maybe see what's going on for that other person. If it involves you, just see the setting that might in your mind relate to or associate with that difficult or more compelling emotion. If there's something being spoken about that elicits concern or fear, or perhaps it's something you've been visualizing happening in the future. And so we begin the practice of rain. The R is to simply recognize. Recognizing whatever is most predominant, and then perhaps mentally labeling that emotion. Worried, anger, grief, tightness, sadness. And then just letting your attention be to allow the A of rain. And that means an open-hearted willingness to simply pause with whatever is here and allow it. Simply allowing whatever you're feeling to be there. Some might find it helpful to make a soft mental note of, it's here right now. It's here right now. Let me be with it. This belongs. Can I just be with it? And just by allowing for a few moments, it enables you to begin to shift to the I of rain, the investigating. And you might notice, what does this emotion feel like in your body? Can you identify where you feel that emotion? It might be in the throat, the chest, the belly, the back of your head, even your lower back. Sometimes when you're doing the process of investigating, you can ask yourself just the gentle inquiry of, what am I believing in this moment about this emotion? What does this emotion say about me? What does this emotion say about my future? And whatever comes up, find out how your body is experiencing that emotion. If you're believing that something bad is going to happen to you, that you're going to lose something precious, where do you experience that in your body? And if you find it helpful, you might want to place your hand wherever you're feeling that, at your throat, the chest, or the belly. For some of us, we've become so disassociated from the sensations in our body that it could be very vague, whatever we're feeling, and that's okay. Just sense that you're inviting whatever wants to be accepted and included into this field of awareness. Just inviting whatever emotion has arisen to be felt fully. Breathing with whatever vulnerability you're contacting, with interest, with curiosity, with compassion, with gentleness. What does it feel like? How is this emotion living in my body right now in this moment? And allowing yourself to attach to the very core of it. Whatever you're experiencing as you investigate, fully allowing it without any defenses, without any resistance, without any rejection, allows you to have that stability of surrender, that surrendering presence of no resistance, whatever you're feeling, and just simply allowing. There is an intimate attention as you make space for that vulnerable part of you. What do I need most right now? And sense that you can listen from the most awake, from the most divine part of you, that wise self. What does this place most need? Is it love? Is it acceptance? Is it faith? Is it hope? And sense that your awake heart, your compassionate nature, your divine soul can offer whatever is needed in this moment. Just allowing that vulnerable part of you to feel washed, to feel bathed with some quality of tender presence, of attention, of loving kindness. And if it's difficult for you to elicit that compassion from yourself, imagine someone in your life who you trust, who's wise, who you know cares about you, from a spiritual figure, from a loving presence. Just imagine and feel and sense that love and that care pouring in. Allow yourself to be nurtured. Just let the deepest intention be for that vulnerable place to be held, to be bathed, to be immersed in ahava, in loving kindness. You could imagine a light, a warmth, feeling yourself bathed in this tenderness. Become aware of this quality of presence that's here and let yourself relax and open to that open, tender presence. And as best you can, notice the difference between being identified as a fearful or agitated or worried self and the spaciousness, the openness, and the freedom of loving presence. And just allowing yourself to rest in that peace within all the turmoil. Just taking a few more deep, full breaths. And so here we are in the midst of this unprecedented uncertainty and the turmoil that's going on outside and both inside. And we need to remind ourselves, can we be that person who Rabbi Nachman reminds us is walking that narrow bridge and still feeling the fear, but you're feeling the intelligence of the fear, and you know now how to hold it with mindfulness, with compassion, and with care. So if you're intentional right now at this junction of time, if you're intentional, and echoing what Rabbi Dr. Freedman said, if you want to move through this, and you will get through this, the suffering and the difficulty that may arise inevitably, can become some of your deepest resources. Higalena ufros chavivi alai es suka shilomecha. Tayir eretz michvodecha, nagila v'nismechavach, maher ahov kiva moed. Please, my beloved, reveal yourself and spread upon all of us the shelter of your peace. Illuminate the earth with your glory, that we may rejoice and be glad with you. Hasten, show love, for the time has come, and show us grace, as in the days of old. Shenishma v'nisbaser besoros tovos yeshuos v'nechamos. Baruch Adonai Leolam, Amen ve'Amen. Thank you so much to Rabbi Dr. Freedman. Thank you so much to Amudim. Am Yisrael Chai. Am Yisrael Chai.
To everyone watching, tonight's theme is Ki ish echad b'lev echad. You are not alone, and we are here for each other. You are here for your patients, for your clients, and we are here for you. And it's so crucial to remember it's okay not to be okay. And as cliche as I feel saying it in these trying times, in these turbulent times, the danger that we're facing now, Am Yisrael, it's unprecedented in most of our lifetimes. And this is the time where we're stepping up to be there for each other, to be there as one. And we thank you, the amount, the volume of, not just forget people who are needing help and reaching out for help, the volume of people out in the field, professionals stepping up and reaching out to volunteer their services, both professionals here in Israel and abroad, is astounding and overwhelming. And we thank you for that, for everyone who is stepping up and doing what they can to help Klal Yisrael, to help Am Yisrael in this awful, scary time. But the bottom line, the scary time, we're here for each other.
Hands in the middle, team. Come on, let's go. 1, 2, 3. Go team, baby.
Go team.
Am Yisrael Chai.
Am Yisrael.